12 Early Cancer Signs and Symptoms. Welcome, everyone. Today, we're embarking on a crucial journey that has the potential to change, and perhaps even save, lives. The journey to recognize the 12 early signs and symptoms of cancer, those subtle whispers your body might be telling you, but are easily overlooked. Stick with us throughout this video and become more adept at decoding these crucial signs. We all have that inner Sherlock Holmes inside us, so let's put on our detective caps and unearth these clues. Remember, knowledge is the first line of defense. So, are you ready to dive into this life-altering investigation? Stay tuned. 1. Unexplained weight loss. Our first subtle yet profound sign is unexplained weight loss. When I say unexplained, I mean weight loss that happens without making significant changes to your diet or physical activity. If you find your clothes hanging loose, or the weighing scale suddenly becoming your best friend without any extra effort from your end, it's a sign to pay attention. Now, you might think, isn't weight loss usually a good thing? Indeed. In a world where we're constantly trying to fend off those extra pounds, unexplained weight loss might seem like a fortunate accident. But when it's unanticipated and substantial, it can be a warning sign that something is not quite right inside your body. So, how is this related to cancer? Let's get into the science of it. You see, cancer cells are essentially rogue cells that grow out of control. This accelerated growth requires energy, and lots of it. To fuel their rapid proliferation, cancer cells can change the way your body uses food for energy. They can speed up your metabolism and push your body to burn more calories than normal, leading to weight loss. Moreover, certain types of cancer, like pancreatic, stomach, lung, or esophageal cancers, can directly interfere with your body's ability to digest food and absorb nutrients, contributing further to weight loss. Some cancers might even secrete substances that cause your body to break down stored fat and protein at an unusually fast rate, leading to weight loss. If you notice that you've lost 10 pounds or more without dieting or exercising, it's a sign to reach out to your healthcare provider. Remember, unexplained weight loss doesn't confirm cancer. It's just one possible early sign that needs investigation. It could be due to other health issues as well, like thyroid problems or diabetes. Nonetheless, it's crucial to get to the root cause and address it promptly. 2. Persistent fatigue. Our second sign, a seemingly innocuous one but one that might carry weightier implications, is persistent fatigue. We all experience tiredness after a long day at work or an intense workout. However, the fatigue we're discussing here is different. It's relentless, persistent, and doesn't improve with rest. Imagine feeling exhausted all the time, like you're walking through thick mud even after having a good night's sleep. If you're experiencing this sort of pervasive tiredness without an obvious cause, it's important to pay heed. So, what's the link between persistent fatigue and cancer? Let's untangle that web. Firstly, cancer itself is a draining condition. As the body attempts to fight off the rapidly multiplying cancer cells, it uses up a significant amount of energy, leading to fatigue. This is particularly true in the early stages of cancer, where the body's immune response is at its peak. Secondly, cancer can disrupt the normal functioning of various organs in the body, leading to fatigue. For example, lung cancer might restrict the oxygen supply to the body's tissues, causing tiredness. Likewise, colon or stomach cancer can lead to a loss of blood, which can manifest as fatigue. Thirdly, certain types of cancer can alter the balance of hormones in the body, which can result in fatigue. For instance, cancers of the adrenal glands can interfere with the production of cortisol, a hormone that helps regulate energy levels. Finally, substances called cytokines, which are produced by cancer cells, can cause fatigue. These substances can affect the central nervous system and disrupt the normal sleep-wake cycle, leading to a sense of persistent tiredness. Remember, just like unexplained weight loss, persistent fatigue is a nonspecific symptom and doesn't confirm the presence of cancer. It's seen in many other conditions like anemia, depression, and chronic fatigue syndrome, among others. However, if it's persistent and unexplained, it does warrant a visit to the doctor to rule out serious conditions like cancer. So the next time you feel exhausted, beyond the bounds of your daily activities and without a clear reason, remember to listen to your body and seek medical advice if necessary. After all, your health is your wealth. 3. Chronic cough or trouble breathing. On to our third early sign of cancer, a chronic cough or trouble breathing. We've all had coughs that keep us up at night, usually due to a common cold or an allergy. But the cough we're discussing here isn't your run-of-the-mill cough. It lingers longer than usual, persisting for weeks, or comes with additional symptoms like shortness of breath or chest discomfort. If you're facing these symptoms, it's essential not to dismiss them, especially if you're a smoker or have a history of smoking. Now, let's delve into how this is connected to cancer. Most commonly, these symptoms are linked to lung cancer. Lung cancer often begins as an area of localized irritation that develops into a chronic cough as the disease progresses. The cancerous cells can obstruct the air passages, leading to difficulty in breathing. Occasionally, a distinctive cough or change in a cough you have had for a long time may also be a sign. But the scope doesn't end there. Certain types of cancer, even if they originated elsewhere in the body, can metastasize or spread to the lungs, causing similar symptoms. For instance, breast cancer, colon cancer, or kidney cancer can spread to the lungs, leading to a chronic cough or trouble breathing. Furthermore, cancers such as esophageal or throat cancer can press on the windpipe or trachea, causing breathing difficulties. Lymphomas, or cancers of the lymphatic system, can also cause a cough or trouble breathing if the tumors enlarge in the chest area and press on the windpipe. 4. Difficulty swallowing. Let's move to our fourth early sign of cancer, difficulty swallowing, also known as dysphagia. It's a condition where you might feel discomfort while swallowing, a sense of food being stuck in your throat or chest, or even pain when swallowing. This might be accompanied by weight loss or a change in your diet due to the trouble you have with swallowing food. It could occur with both solids and liquids. Now, how does this relate to cancer? Let's delve into that. Difficulty swallowing is often associated with cancers of the esophagus, throat, and stomach. Cancer can cause changes to these areas either through tumor growth that physically obstructs the passage or through the stiffening of the walls of the esophagus or throat, making the process of swallowing difficult. Esophageal cancer, for instance, can narrow the passageway of the esophagus, making it hard for food to pass down to the stomach. It can also cause a painful or burning sensation during swallowing. Similarly, stomach cancer can obstruct the entrance to the stomach, leading to similar difficulties. Furthermore, cancers in the neck, such as thyroid cancer or laryngeal cancer, can press on the esophagus, affecting the normal swallowing process. Sometimes, cancers that have metastasized, or spread to the lymph nodes in the neck or chest, can also cause difficulty swallowing. As always, it's important to remember that difficulty swallowing can be associated with many non-cancerous conditions too, such as gastroesophageal reflux disease, GERD, stroke, or neurological disorders. Therefore, while difficulty swallowing doesn't necessarily mean cancer, it's a symptom that should never be ignored. Early detection of cancer significantly improves the chances of successful treatment and survival. So, if you or someone you know is facing persistent difficulty swallowing, encourage them to consult with a healthcare provider promptly. 5. Persistent indigestion. Navigating to our fifth early sign of cancer, persistent indigestion. Occasional heartburn, upset stomach, or a bloated feeling after a heavy, spicy meal is pretty normal. However, if you're dealing with a consistent case of indigestion that doesn't seem to go away, it's worth paying attention to. Now, how does persistent indigestion tie into the realm of cancer? Let's explore this. Persistent indigestion, characterized by feelings of discomfort or burning in the stomach, bloating, excessive burping, or nausea, can sometimes be a sign of cancers in the digestive tract. This includes cancers of the esophagus, stomach, pancreas, and gallbladder. For instance, stomach cancer or gastric cancer can cause inflammation and irritation in the lining of the stomach, leading to persistent indigestion. Esophageal cancer can also cause indigestion by disrupting the normal passage and digestion of food. Pancreatic cancer is another type where indigestion can be a symptom. The pancreas produces enzymes that aid in digestion. If a tumor blocks the pancreatic duct, these enzymes may not reach the intestines to help break down food, causing indigestion. Even cancers that are not directly located in the digestive system, like ovarian cancer or urinary bladder cancer, can cause indigestion. These tumors can press against the stomach or intestines, causing discomfort and indigestion. As with the other symptoms we've discussed, persistent indigestion can be due to a variety of non-cancerous conditions too, like peptic ulcers, gastritis, or gallstones. The key here is the term persistent. If your indigestion isn't responding to usual treatments, if it's continuous, or if it's accompanied by other symptoms such as weight loss, difficulty swallowing, or persistent vomiting, it's vital to consult with a healthcare provider. Understanding these symptoms and their potential implications equips us to take charge of our health. So, if that gnawing discomfort or feeling of fullness seems to persist in your stomach, it might be more than just that spicy meal you had. 6. Night sweats. Advancing to our 6th early sign of cancer, night sweats. Now, we're not just talking about the occasional overheating due to a warm room or heavy blankets. The night sweats we're referring to are severe hot flashes occurring at night that can drench your clothes and bedding, not related to an overheated environment. So, how do night sweats tie into cancer? Let's dissect this. Night sweats can be associated with certain types of cancer, most commonly lymphoma, or cancer of the lymphatic system. In lymphoma, the cancer cells can produce substances called cytokines that affect the center in the brain that regulates body temperature, leading to night sweats. In addition, night sweats can also be a symptom of leukemia, or cancer of the body's blood-forming tissues. The fast-growing leukemia cells can cause a variety of symptoms, including night sweats, as the body attempts to fight off these rogue cells. Furthermore, certain cancers like liver cancer or kidney cancer can cause fever and night sweats. The reason is twofold. Firstly, the cancer cells themselves may release substances into the bloodstream that cause a fever. Secondly, the body's immune response to the cancer cells can also raise the body's temperature, resulting in fever and night sweats. Additionally, cancers that have spread or metastasized to other parts of the body can cause night sweats. This is particularly true for cancers that spread to the liver or adrenal glands, organs that play a role in regulating body temperature. It's important to remember, though, that night sweats can also be associated with many non-cancerous conditions such as infections, hormonal imbalances, or certain medications. Therefore, while night sweats don't confirm the presence of cancer, they should never be ignored, especially if they're frequent, severe, and accompanied by other symptoms like unexplained weight loss or persistent fever. So, if you find yourself regularly waking up drenched in sweat, and it's not because you're overdoing the heating or blankets, don't just dismiss it. 7. Changes in vision. Stepping into our 7th early sign of cancer, changes in vision. We're referring to sudden or gradual changes such as blurred vision, double vision, seeing floaters or flashes of light, loss of peripheral vision, or even complete loss of vision that cannot be corrected with glasses or contact lenses. Now, let's uncover how changes in vision can be linked to cancer. Eye or ocular cancers such as retinoblastoma or melanoma of the eye can directly affect your vision. These types of cancer can cause a range of visual disturbances, from blurred vision and floaters to complete vision loss. Furthermore, certain cancers can metastasize, or spread, to the eye, affecting vision. Lung cancer or breast cancer, for instance, can spread to the eye and lead to changes in vision. Brain cancers can also impact your vision. Tumors in or near the parts of the brain that are involved in vision, like the optic nerve or the visual cortex, can cause various visual symptoms. These could include loss of peripheral vision, double vision, or even complete vision loss. In addition, pituitary tumors, although not malignant in most cases, can press on the optic nerve as they grow and lead to vision changes. Similarly, cancers of the nasal cavity or sinus can extend into the orbit, affecting the eye and causing vision changes. Cancers can also indirectly affect vision through other complications like high blood pressure or diabetes, or through side effects from cancer treatments, such as certain chemotherapy drugs or radiation therapy. As always, it's crucial to remember that changes in vision can also be due to many non-cancerous conditions, like cataracts, glaucoma, or macular degeneration. However, any unexplained, persistent, or sudden changes in vision should be evaluated by a healthcare provider to rule out serious conditions, including cancer. 8. Persistent low-grade fever. Moving on to our 8th early sign of cancer, persistent low-grade fever. We're talking about a fever that may not be severe, but it is continuous or recurrent over a significant period. This kind of fever, especially if it's unexplained by other conditions like an infection, can sometimes be an early sign of certain types of cancer. But how does a persistent low-grade fever connect with cancer? Let's delve deeper into this. In the context of cancer, a fever can develop for several reasons. Cancer cells themselves can produce substances called pyrogens that can cause a fever. They can also stimulate the immune system to produce a fever as it battles against these abnormal cells. The most common types of cancer associated with fevers are lymphomas, leukemia, and liver and kidney cancers. In lymphomas and leukemia, the fever is often a direct result of cancer cells in the lymphatic system or blood. In liver and kidney cancers, the fever may result from the cancer cells producing pyrogens. Fever can also be a symptom of cancers that have spread, or metastasized, within the body. Cancer cells traveling to new locations can provoke an immune response, leading to fever. Furthermore, some cancers may cause fever due to the inflammation or necrosis, death of cells or tissues, they cause in the body. However, it's important to note that a persistent low-grade fever is associated with many conditions other than cancer, like autoimmune diseases or chronic infections. Therefore, while a persistent low-grade fever does not definitively indicate cancer, it should prompt a consultation with a healthcare provider, especially if it's accompanied by other unexplained symptoms. 9. Skin changes. Moving forward to our 9th early sign of cancer, skin changes. Skin changes can range widely, including new growths, sores that don't heal, changes in existing moles, or changes in skin color or texture. But how are these changes in the skin linked to cancer? Let's explore. Skin changes can directly signal skin cancer, including basal cell carcinoma, squamous cell carcinoma, and most importantly, malignant melanoma. These cancers can present as new growths or changes in existing moles, freckles, or birthmarks. Signs to watch out for include asymmetry, irregular borders, changes in color, diameter greater than 6 mm, or evolution over time, often remembered by the acronym ABCDE. Skin changes can also be a sign of cancers that originate in other organs but manifest skin symptoms. In lung cancer, certain specific skin changes like hypertrophic osteoarthropathy, clubbing of fingers or toes, may be seen. Furthermore, some systemic cancers like lymphoma can cause itching, known as pruritus, due to substances released by the cancer cells. Some cancers, like pancreatic cancer, can cause yellowing of the skin or jaundice, due to blockage of the bile duct by the tumor. Certain internal cancers can also produce substances that mimic hormones, causing a variety of skin changes. For example, bronchogenic carcinomas, lung cancers, can secrete ACTH, a hormone that leads to skin darkening similar to a suntan. 10. Muscle or joint pain. Transitioning to our 10th early sign of cancer, muscle or joint pain. Persistent or unexplained muscle or joint pain that doesn't improve with rest or treatment can sometimes be a sign of certain types of cancer. Muscle or joint pain can be a symptom of bone cancer or cancers that have metastasized, or spread, to the bones, like lung, breast, or prostate cancer. In bone cancer, the pain is typically constant and may become more intense over time. The pain may also increase with movement. Metastasis to the bone can cause pain in the affected area and may also weaken the bone, leading to fractures with minimal injury. Furthermore, cancers of the muscles, called soft tissue sarcomas, can cause muscle pain. These are rare cancers that can occur in any part of the body's soft tissues, including the muscles, tendons, fat, blood vessels, lymph vessels, and nerves. Leukemia, a cancer of the blood cells, can cause joint or bone pain as a symptom. As leukemia cells crowd out normal blood cells in the bone marrow, they can cause pain in the bones or joints. It's crucial to remember, though, that muscle or joint pain is common and is usually related to non-cancerous conditions like arthritis, injuries, or physical strain. However, persistent and unexplained pain that doesn't improve with rest or treatment should not be ignored. Let's stay vigilant and proactive. 11. Loss of appetite. Proceeding to our 11th early sign of cancer, loss of appetite. This refers to a reduced desire to eat, often accompanied by unintentional weight loss, and can sometimes be an early indication of certain types of cancer. A loss of appetite can be directly caused by cancers of the gastrointestinal system, such as stomach, pancreatic, colon, or ovarian cancer. These cancers can cause a feeling of fullness or discomfort, reducing the desire to eat. For instance, a tumor in the stomach can reduce its capacity, causing a feeling of fullness after eating a small amount of food, leading to a decreased appetite. Similarly, ovarian cancer can cause a buildup of fluid in the abdomen, known as ascites, that can lead to bloating and loss of appetite. Furthermore, any cancer that spreads to the liver can affect appetite. The liver plays a crucial role in regulating appetite by managing levels of specific hunger and satiety hormones. When liver function is disrupted by cancer, this can lead to a loss of appetite. Cancers can also cause a loss of appetite indirectly through the general systemic effects they can have on the body, such as causing inflammation, disrupting hormone levels, or causing nausea and vomiting due to treatments. Of course, it's essential to note that loss of appetite is common in many non-cancerous conditions, including depression, anxiety, or certain infections. So, if you find your favorite foods no longer appeal to you or your meals are becoming increasingly smaller, it might be time to schedule an appointment with your healthcare provider. Ignoring these changes in your appetite can delay the detection of potential underlying conditions, including cancer. 12. Unexplained anemia. Moving to our final early sign of cancer, unexplained anemia is a condition characterized by a lower than normal number of red blood cells or a lack of enough hemoglobin, the protein that carries oxygen in these cells. Symptoms can include fatigue, weakness, pale skin, and shortness of breath. But how does unexplained anemia tie into cancer? Let's unravel this. Anemia can be caused by several types of cancer. In cancers such as leukemia or lymphoma, the cancer cells crowd the bone marrow, where red blood cells are produced, leading to anemia. Furthermore, some cancers, particularly those that involve bleeding, such as colorectal or stomach cancers, can cause iron deficiency anemia. This happens when the body loses more iron, in the form of blood, than it can absorb from food, resulting in anemia. This is often the reason why anemia can be the first sign of a hidden or occult gastrointestinal cancer. Cancers can also cause anemia indirectly through systemic effects. Some cancer cells release substances that interfere with the production of erythropoietin, a hormone crucial for red blood cell production. Additionally, the inflammation caused by some cancers can interfere with the utilization of stored iron, leading to a condition known as anemia of chronic disease or anemia of inflammation. Anemia can also be a side effect of cancer treatments, such as chemotherapy or radiation therapy, both of which can affect the bone marrow's ability to produce red blood cells. It's important to remember that anemia has many potential causes other than cancer, including dietary deficiencies, certain chronic diseases, or other benign conditions. However, unexplained anemia, especially when accompanied by other symptoms such as fatigue or weight loss, should always be investigated further. And there you have it, our comprehensive exploration of the 12 early signs and symptoms of cancer. We've traversed a journey through our bodies, learning how these signs can quietly hint at a much larger health issue. Remember, knowledge is not only power, but it can also be a lifeline. By being aware and vigilant, you can detect these signs early, offering you the best chance for successful treatment. Remember, the aim of this video was not to alarm you, but to arm you with knowledge. So, if your body whispers these signs to you, don't wait for them to become a shout. Seek advice, get checked, and stay proactive about your health. It's the one treasure we should never compromise. Thank you for joining us in this enlightening journey. If you found this video useful, please give it a thumbs up and share it with your friends and family. You never know whose life this knowledge might touch. Subscribe and hit the bell icon for more informative videos like this.